Asbestosis is a chronic long-term lung condition caused by exposure to asbestos. Asbestos is a general term for a group of minerals made of microscopic fibers. In the past, it was widely used as a building material. Asbestos can be very dangerous. It does not present a health risk if it's undisturbed. But if material containing asbestos is chipped, drilled, broken, or allowed to deteriorate, it can release a fine dust that contains asbestos fibers. When the dust is breathed in, the asbestos fibers enter the lungs and can damage them over time. However, it's not the only factor, as many people avoid getting asbestosis. Despite heavy exposure, jobs linked with asbestos exposure, the use of asbestos peaked during the 1970s, before declining during the 1980s and 1990s. You may have been exposed to asbestos if you worked in an industry where asbestos was used during this time. Jobs particularly linked with exposure to asbestos include insulation workers, boilermakers, plumbers, pipe fitters, and steam fitters, shipyard workers, sheet metal workers, plasterers, chemical technicians, heating, air conditioning, and refrigeration mechanics. Nowadays, you're most at risk if your job puts you at risk of damaging asbestos in older buildings. For example, caretakers, electricians, and demolition workers. Diagnosing asbestosis. Your GP may ask you about your symptoms, listen to your lungs with a stethoscope if your lungs have been affected by asbestos. They'll usually make a crackling noise when you breathe and ask about your work history, particularly about possible exposure to asbestos. Arrange a chest X-ray if asbestosis is suspected. You will be referred to a specialist in lung diseases for tests to confirm any lung scarring. These may include a computerized tomography, CT scan, lung function tests. The specialist will also consider other possible causes of lung inflammation and scarring. For example, idiopathic pulmonary fibrosis, hypersensitivity pneumonitis, and connective tissue disease-related interstitial lung disease. Treatment for asbestosis. There is no cure for asbestosis once it has developed. It's not possible to reverse the damage to the lungs. Sometimes, depending on the pattern of scarring seen in the lungs, you may be considered for antifibrotic therapy to reduce progression of your lung condition. Pulmonary rehabilitation may be recommended. There are things you can do to help your symptoms. Stop smoking. If you've been diagnosed with asbestosis and you smoke, you should stop as soon as possible. Smoking can make breathlessness worse. It can also significantly increase your risk of developing lung cancer. Speak to your GP for help with giving up smoking. You can also phone Quit Your Way Scotland on 0800 84 84 84 to get more help and advice about quitting smoking. How to prevent asbestosis. Large amounts of asbestos are still found in many older buildings. You should take precautions if you live or work in a building that may contain asbestos. If you think your house may contain asbestos, contact an environmental health officer at your local council. Do not attempt to remove any materials that you think may contain asbestos yourself. If your job means you could be exposed to asbestos fibers, make sure you are fully aware of how to reduce your risk. Do not attempt to remove any asbestos you come across, unless you have been trained in how to do this safely.